Mississippi has the highest rate of heart disease than any other state in the nation. Also, heart disease affects African Americans more than any other demographic. And in addition, Mississippi has the highest population of African Americans. So, what is heart disease? It's essentially a term that refers to all diseases that affect the heart. But one of the main causes of heart disease is the calcification of the arteries. So, just for demonstration purposes, imagine if your artery was this big. It's not, just for demonstration. And imagine your artery being this big and having all this space for blood to flow through. And as calcification occurs and calcification is deposited on the inner lining of the artery, and the space for blood to flow gets smaller, and the actual space for your blood to flow through becomes very narrow, as opposed to your artery starting out being this big, it becomes this big. And so if you can't get blood to your heart or to your brain, blood carries oxygen and nutrients, the tissues will start to die and not function properly. So that leads to heart attack as well as stroke. So one of the main causes of this, there are several different things that lead to calcification, but one of the most sort of astonishing things that researchers have found is that smooth muscle cells that are native to the artery, they are in that middle layer of the artery, they actually undergo a genetic switch and start to act like osteoblasts, which are bone cells, and actually deposit a bone mineral inside your arteries. So, let's see some of the faces. Yes, bone in your arteries. I know that's scary, but sad to say it gets a little worse. So, renal disease or kidney disease leads to very severe calcification. And once again, way to go, Mississippi, have the highest rate of renal disease than any other state in the nation. And actually, in fact, patients that suffer from renal disease actually end up succumbing to heart-related complications as opposed to kidney failure. And again, all that's very scary, but finally I have some good news for you. So the body is actually trying to heal itself. So the body produces these natural proteins that sort of work as chaperones. And so the way that these proteins work is they attach to that mineral that's circulating in the blood and actually carry it out of the body to inhibit this mineralization from occurring. And also, one thing to point out, dialysis, which is one of the main treatments for renal disease, actually strips the body of all these natural proteins, and that's one of the main reasons that causes this calcification and why it's so severe in patients with renal disease. Also, research has shown that osteoclasts, which are the only cell type that has the ability to resorb bone, sort of go in and eat away that bone mineral and get rid of it for good. Some research has shown that osteoclasts has actually been found in some calcified arteries. So the body is trying its best to, heal itself, but the disease is too severe. So through my research, I want to develop therapies to help the body sort of heal itself. So I'm working on developing injectable therapies that will deliver those natural chaperone proteins and osteoclasts to the site of calcification. So sort of giving the body what it needs to help heal itself as it's already starting to. And so the benefits of these injectable therapies are that, for one, you won't need any specialized doctor or physician to administer these treatments. No hospital stay will be required, no anesthesia, it will be a simple injection. And this will have the ability to impact rural patients, and Mississippi has a lot of rural areas. And also, these therapies would definitely be cheaper than what's being offered now. So how can we work together? I sort of envision combining my basic science research about the disease and about developing these treatments with some of your work. And from what I remember from the first meeting, some of you are working to educate the community on the importance of prevention. We can combine basic science research with some of the data that, how you're working to educate the community and sort of getting people to understand that it's easier to prevent a disease from occurring, because once you get to that last stage of kidney disease where you have to go on dialysis, the life expectancy is 3 years. And also that dialysis is only stripping your body of what it needs to heal itself. So prevention is definitely key. And then also, I remember hearing some people talk about working on evidence-based practices. So being able to understand and figure out why doctors aren't adopting these new practices and getting them to adopt new treatments that could possibly be cheaper and actually reverse the disease as opposed to making it worse. And then also creating a policy change to get insurance companies to pay for the best treatment as opposed to the